Today's learning objectives are: number 1, know what a care plan is and why they are needed. Number 2, know the difference between a baseline care plan and comprehensive care plan. And number 3, know what is needed to write a person-centered care plan. Care plans are the action plan created by residents or resident representatives and staff on what will be done to get the resident from where they are to where they want to be. They are the plans that communicate what action is to be done or interventions to help the resident reach their goals based on the resident's conditions, situations, needs, preferences, or risk for potential conditions and situations. Planning a resident's care begins on admission and is updated as the resident changes or the resident representative change their goals or change their interventions. Baseline care plans. The goal of the baseline care plan is to provide an initial set of instructions needed to provide effective and person-centered care of the resident that meet professional standards of quality care. Baseline care plans are to be written within the first 48 hours of admission. Baseline care plans must include the minimum health care information necessary to properly care for the resident, such as initial goals based on admission orders, physician's orders, dietary orders, therapy services, social services, and PASARR recommendations if applicable. Baseline care plans may also include information from the transferring provider, such as hospital transfer records, our interim temporary approaches for meeting the resident's immediate needs, and they also are to be updated as needed to reflect changes that may happen if the resident has a significant change in their condition or has a change in their needs, desires before the comprehensive care plan is developed. The resident and the representative must receive at least a summary of the baseline care plan that would include the initial goals of the resident, a summary of the resident's medications and dietary instructions, any services and treatments to be administered by the facility and personnel acting on behalf of the facility, and any updated information based on the details of the comprehensive care plan as necessary. Once the comprehensive care plan has been developed, the baseline care plan no longer needs to be kept updated or shared with the resident or representative. Comprehensive person-centered care plans. Facilities are required to develop and implement a comprehensive person-centered care plan for each resident, consistent with the resident rights. That includes measurable objectives and timeframes to meet a resident's medical, nursing, and mental and psychosocial needs that are identified in the comprehensive assessment. Comprehensive care plans are to be written within 7 days of completing the comprehensive assessment and no more than 21 days after an admission. Comprehensive care plans must include person-specific measurable objectives and timeframes in order to evaluate the resident's progress toward his or her goals. Make an effort to understand what each resident is communicating, verbally and non-verbally. Identify what is important to each resident with regard to daily routines and preferred activities. Have an understanding of the resident's life before coming to reside in the nursing home. When developing the comprehensive care plan, facility staff must at a minimum use the Minimum Data Set, MDS, to assess the resident's clinical condition, cognitive and functional status, and use of services. The Care Area Assessment, or CAA, will trigger for any area that requires further assessing. Documentation will be needed to determine decision-making process, whether or not to care plan. If care plan, then documentation will explain and support the care plan. Should be prepared and signed by an interdisciplinary team that at the minimum includes the attending physician, registered nurse with responsibility for the resident, nurse aide with responsibility for the resident, member of the food and nutrition services staff, and other staff or professionals as determined by the resident's needs. Care plans come in a variety of formats and styles, as regulations do not specify how the care plan should look. However, care plans usually have the following standard components: problem statement. Example, should define the resident's problems and risks, should clearly state the physical function and psychosocial strength as well as needs, deficits, concerns, and risk factors. Mr. Smith currently weighs 190 pounds, however, he usually weighs between 180 and 185. Goals clarify the purpose of the providing care and the criteria that healthcare personnel should use to determine if the care plan is effective and if objectives are being met. They need to be realistic, specific, and measurable, and include the resident's personal and cultural preferences. For example, a resident wants to weigh between 180 and 185 pounds. If the resident or representative cannot provide a goal, then the writer will use current standards of clinical practice to determine an appropriate goal for the resident. Interventions or approaches must be specific, measurable, individualized elements of care provided by staff, which will help residents achieve their goal. Instructions for delivering resident care and allow for continuity of care by all staff. For example, Mr. Smith would like to attend exercise class daily and would like reminders or an escort to the exercise classes. Mr. Smith would like to have fruit for dessert, but on occasion will select a regular dessert if it's one of his favorites. Weigh weekly and inform Mr. Smith of his progress. Care plans must specify which care discipline, nursing, dietary, therapy, is responsible for carrying out each intervention. Update any or all parts of the care plan as the resident changes or as the resident representative change their mind on goals and/or approaches. Follow up with residents and observe them at meals to make sure they are making progress toward their goals and objectives. Do not wait until the next scheduled assessment or care plan date to make changes in the care plan. By updating the care plan, the staff will be aware of the most current plan for how to care for the resident. Testing your knowledge on care planning. Question number 1. Without a care plan, the interdisciplinary team may not know details about the resident to A. Help prevent further problems, B. Provide care and services according to a resident's or representative's needs, preferences, C. None of the above, or D. Both A and B. And the answer to question number 1, without a care plan, the interdisciplinary team may not know details about the resident to D. Both A and B. Question number 2. When writing a comprehensive person-centered care plan, the writer must include A. Measurable goals, B. Goals the resident or representative wants, C. Interventions that will help the resident reach their goal, or D. All of the above. And the answer to question number 2, when writing a comprehensive person-centered care plan, the writer must include D. All of the above. Question number 3. Care plans must be written within blank days of completing the comprehensive assessment. A. 5, B. 7, C. 14, or D. 18. And the answer to question number 3, care plans must be written within B. 7 days of completing the comprehensive assessment. Question number 4, true or false? Care plans are the action plan created by residents or resident representative and staff on what will be done to get the resident from where they are to where they want to be. And the answer to question number 4 is true. Question number 5. Baseline care plans are to be completed within 48 hours of admission. And the answer to question number 5 is true. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information about our in-service training programs or consulting dietitian services, please contact us at 1-800-761-9200 or nutritioncaresystems.com.